Okay. Alright, so for the first one, we have cervical active range of motion, rotation with the goniometer. So what I'm actually going to have you do is sit in this chair right here. So let's face the camera there. There you go. Alright, so what I'm going to have you do, I'm actually going to hop on this table back here, is I'm just going to be looking at how your head can turn left and right. So what I'll have you do is go ahead and try to, so I want you to keep your nose kind of on a single line so that it's not going up or down, so you're purely just kind of rotating like this to both sides. So I'll have you start with rotating to the left. Okay, I'm just going to, and that is 55 degrees. Alright, and then let's do the other side. So go ahead and do the same thing but rotate to the right. And that is 62 degrees.
Okay.
Alright, and any pain with any of those?
No.
Okay. Alright. And next is the Sperling's test. So what I'm going to have you do is you can stay seated in that chair. I'm actually going to scoot you up a little bit though so I can get behind you here. Alright, so this is a test for cervical radiculopathy, radicular symptoms. So what I'm going to actually do is I'm just going to have you just kind of relax. I'm going to move your head to one side and then give you a little compression. And I just want you to let me know what that does, if that reproduces any of the symptoms that you've been having. Okay?
Ow, that hurts.
Okay. Alright. And let's try it. Is that the same symptoms you've been feeling?
Uh-huh.
Okay, let's try the other side. Let's see.
That's okay.
Okay, so that's better. Okay. Alright, now muscle length test of SCN. So I'll have you come lay on your back on the table. I'm just going to be behind you here. Lower this down. Alright, so I'm actually going to have you scoot back towards me to where your head can kind of hang off the table. There you go, perfect. Alright, so we'll do... Anything here? Okay, so you're testing the right one, then we'll compare it to the other side. All right there? Yeah. Okay. All right, good. So I put into a side bend, contralateral side bend, but then ipsilateral rotation, and then you can add an extension if needed. Next is accessory motion testing, thoracic unilateral PA, one side only. So I'm going to have you lie on your stomach.
Okay.
So all I'm doing here is looking at some of the way that your spine is moving. So I'm just going to be giving you some pressure along your spine here. I just want you to let me know how it feels. And if you feel any more that are giving you pain, or if you feel any that feel kind of tight or stiff. Okay? Actually, let me go on the other side so the camera can see. Alright. Sorry. Hands are cold. Try to warm them up. Okay. So, coming off spinous process, strumming defined. so I'm going to give you the pressure here, okay? So I'm just going to get an idea of how much it's moving. Check different levels. Feel okay? Check the other side. Good. Any pain with any of those?
No.
Okay. So for that one, I was just getting an idea of how much range I felt. So 5 is joint mobilizations, prone, central PAs, C2 to C7, grades 1 to 4 to any 2 segments. I'm going to keep this with me for that one. Alright. Okay, so she's already prone. Gonna actually lower your head a little bit just so I can get. There we go. Does that feel alright?
Yeah.
Alright. So I'm gonna raise the table up just a little bit so that we can. Alright. So if I'm doing central PAs, I like to do it with my thumbs on spinous process. Use my body more. So I'll pick C2 to do my grades. So do grade 1. Grade 2. Slowly back out. And I would typically do that for around three sets of around 30-ish, but it's patient dependent. So if she had symptoms reproduce with that, probably back off, or if I wasn't seeing any progress with them. So then we'll keep going down and just getting the joint mobs at the different positions. So I'm going to come down and do my second grades at C4. So do grade 1. Grade 2. Grade 3. 4. Back out. Alright, that feel okay?
Yeah.
Alright, then I could continue to do the joint mobs down to C7. Whether it be grades 1 and 2 for pain or 3 and 4 for more of the stiffness or hypomobility. 6 is shoulder passive range of motion, internal rotation with a goni. So what I'm going to have you do is lie on your back. Alright. So let me have you actually scoot over that way just a little bit. Perfect. Good. Alright, so all we're going to do here is at this angle right here, I'm going to have the goni set up to perpendicular with the ceiling. I'm going to get an idea first of it. So I feel a firming feel right there. So that's 48 degrees. Okay. 0 to 48 degrees. Next one is accessory motion testing, glenohumeral inferior glide at 90 degrees of abduction. So, all right, Tinsley, so what we're going to do for this one, I'm just going to check, same thing that we did with the spine, I'm going to actually check the way that your shoulder's moving. So I'll just have your arm here, and at any time if this gives you any pain, let me know. So just getting an idea of how your shoulder joint is moving. Feels like it moves a lot. Okay. And I can compare it to the other side to see if there's differences or if that's just a her thing. Next one is joint mobilization, glenohumeral joint lateral distraction, grades 1 to 4. So I'm going to sit next to you here, is that all right?
Yeah.
Okay. So same thing that we were just kind of doing, but we're going to turn it into a treatment. So just let me know if you have any discomfort with this, okay? Just going to get a general idea of your range real quick before we do that. All right. Push past soft tissue. Grade 1. Grade 2. Grade 4. Anything with that?
No.
Okay. And same thing with that, you could do the 3 bouts of 30-ish reps or mobs and then see how the patient's tolerating it. 9 is the apprehension relocation test. So what I'll do is this is a test for just looking at like a general shoulder instability. So what we'll do is bring the arm out to about 90. So, all right, so Tinsley, what I'm going to do is I'm going to start to move your arm back like this. I want you to just let me know when you have any of that pain or any kind of feeling like it's unstable or anything like that, okay? And so during this, I'm looking at her face to see if I see anything like that. So now what I'll do is give her some anterior posterior pressure at the humeral head to try to do the relocation and then go further.
Yeah, feels better.
And if it feels better. So that would be a positive. And then, like the other thing, compare bilaterally to see if that's just a her thing or if that's strictly with the right shoulder. And then number 10 is resisted test for serratus anterior. So I'm going to, actually, we can just sit on the edge of the bed here, lower it down a little bit. All right, Tinsley, so we're going to test the strength of one of the muscles that helps you do kind of like this. So what I'll have you do is bring the arm out, and what you're going to do is press out like that, and then back, so that right there. So what I'm going to do is I'm going to have you try to keep that position, and I'm basically trying to push you back, okay? So I have one of my hands giving the resistance here, and then one at the scapula. Alright, so don't let me move you, okay? Okay, and then I'll go ahead and test the other side. So same thing, push out, good. Alright, don't let me push it back. Alright, so I would give her a 5 on both sides. Even with max resistance, she kept it. And that is my 10. Yay.